Good evening, everyone. My name is Tony Mancuso, and I serve as the Communications and Outreach Senior Specialist for the Summer Health Professions Education Program, also known as SHPEP. For those of you who are unaware, SHPEP is a free 6-week summer enrichment program for college freshmen and sophomore students who are interested in the health professions. To learn more, please visit shpep.org. Tonight, our audience is comprised of SHPEP alums, pre-health advisors, and anyone who is interested in learning more about public health. That being said, I'd like to introduce Tracie Seward. She serves as the Senior Director for Outreach and Recruitment at the Association for Schools and Programs of Public Health and will lead tonight's session. Please use the Q&A feature to ask questions throughout the presentation. And as always, SHPEP webinars are posted on our YouTube channel within a week of the live viewing. Tracie, feel free to take it away.
Great, thank you so much. I'm really excited to be here today talking to you all about one of my favorite things, applying to school in public health and careers in public health. So let's jump on in. We are going to talk a little bit about background, resources, the requirements for the application and the timeline for your application, and leave plenty of time for Q&A at the end. So like you said, feel free to drop the questions in the Q&A box at any point and we'll address those at the end. Okay, so a little bit of background. Who am I? As Tony mentioned, I'm the Senior Director of Outreach and Recruitment for the Association of Schools and Programs of Public Health. So before this, I was actually Director of Admissions at a school of public health. And now I work with all of our members to help students connect to public health more holistically. So building awareness about what public health is for all of our members. So our members are schools and programs. Our vision is to have improved health for everyone everywhere. And our mission is strengthening the capacity of our members for advancing leadership excellence and collaboration for academic public health. And so that's 132 members, like I said, across the US and around the world who are CEF accredited. That's the Council for Education and Public Health. And so that's who we represent, and that's who I'll be talking about for all of today. So for ASPPH, we have 3 brands that relate to student pathways. The first is This is Public Health. You might have heard of us somewhere or come to one of our events or seen us on social media. The next is SOFIS, which is our application service. It's the centralized application service for public health. And the third is Public Health Jobs, and that's where you can find information about careers. So I want to talk a little bit about careers first, which maybe seems a little bit backwards, but we're going to set a foundation here so that we can talk about how you're going to get there through your education. So we have 3 levels: undergrad, master's, and doctoral degree, and they're all going to prepare you to do different types of work within the field. So at the undergraduate level, you might have a BA or a BS, and that degree is really going to give you a good lens for how to view the world and to think about the systems that are impacting health throughout the world. When you graduate with a BA or BS, you are likely to have an entry-level position, perhaps as a health educator or working in a health department. You might work at a nonprofit or in the private industry. At the master's level, which is mostly what we'll be focusing on today, but our most popular degree is the MPH, Master of Public Health. We also have MS degrees, MHA, which is a Master of Health Administration. We have a variety of joint degrees, so you could become an MD MPH or a JD MPH or a variety of other /MPH degrees. At this level, though, you're going to really be prepared for practice and somewhat for research. So many of our students can go their entire career with just a Master of Public Health, and they are able to get to exactly the level of career they want, and they're very happy. These are going to let you get to more experienced careers at the federal and state level. You might get work at nonprofits or again in private industry. So it's a really solid degree option for many students. But some do choose to go on and get a doctoral degree, and we offer 2. There's a traditional PhD program, which is research heavy, and the DRPH, Doctor of Public Health, which is more practice and leadership focused. Both of these degrees are really going to prepare you for the highest levels of opportunities, leadership positions and research positions in academia or nonprofits and other industries. So why would you choose public health when there's so many great options out there? For me, it boils down to three things, and that's purpose, passion, and impact. So what you can do really meaningful work in public health. The work that you do is going to impact tens of people to billions of people, which is huge. You're going to be improving the lives for people around the world. And most students are able to, they're very passionate about the issues that they're able to work on. And so they get to use their passion in their work. And so for me, that's the perfect trifecta, that you're getting to do all of those things. And public health is so broad and interdisciplinary, you can do it in a variety of settings and all types of skill sets. So it's really great. I'm trying to think if there's anything. Oh, the one thing that you should know is that unlike a clinical degree, where clinical workers tend to work with patients in a one-on-one setting, and they're usually working to treat diseases, public health people are working at the community level, generally speaking, and they're working to prevent disease prevent you from getting to the doctor's office in the first place and having to be treated. So it's really meaningful work. So this is just a quick graph of the top employers of public health graduates. This is from our ASPPH annual reporting a few years back. You'll see healthcare organizations are the largest employer of public health graduates, but when you break it out by degree level, academia is still the largest employer of doctoral graduates, and for-profit industries are the largest employers of undergraduate graduates. And it's also worth noting that 28% of undergraduates also go on to further study after completing their public health degree. So they're going on to get their master's. So where are they finding their jobs? A lot of people are using publichealthjobs.org as a search engine. It's a free resource for both job seekers and employers and serves as our recommended search engine for public health job opportunities. And they have everything from entry to executive level on there. It continues to highlight the field of public health as a meaningful career choice and engagement with practice and community. There's tons of posts, new posts every week. There's over 1,300 unique employers on the site, and there's jobs from all over the world. So even if you're not sure about public health or you're not ready to go into the workforce, I always recommend it to students to just kind of get an eye on what's out there and what kinds of roles they might be interested in and start looking for themes. So maybe you see that every job that you're interested in requires a Master of Public Health in maternal and child health. Well, so that's going to help you narrow that when you're looking for your master's program, you're going to look for one in maternal and child health. Or maybe they all look for statistics and you need biostats. So these are good things to note so that you can kind of start honing in where you want to try going with your career. Okay, but let's get to the meat of it, which is finding your grad school fit. We have so many opportunities for you to get involved and also just learn, because it's very important to do your homework and be ready to apply for your master's degree. One thing, it's not like an undergraduate degree. You really want to be a little bit more focused and know what you want to study. So let's talk about how we can help you. Our most popular resources are Academic Program Finder. This can be found on our three main websites, ASPPH, thispublichealth.org, and sophis.org. When you go to the Academic Program Finder, you can search for area of study, you can search for institution by keyword if there's a topic that you're particularly interested in. Under delivery method, you can see if it's an online program or hybrid programs. Actually new this year, and it's just launching, I think, this week. You can now also search to see who requires the GRE. So that's a pretty exciting addition to our program finder. But I spend a lot of time on the program finder, and I know it's a really useful tool for our students as well to kind of just start seeing what's out there and what might be a good fit. Additionally, we have a digital view book that we offer. This also just launched. I should have put the new cover on it. But when you give us your email address, you get access to this free download, which talks a little bit about different careers in public health. It talks about our events and opportunities that you can explore. But the meat of it is that there's a page on every single one of our members in this booklet. And so you can actually search the document for keywords. You can use the information you found in the program finder and look up particular schools, and you'll get to see how big is the school, where are they located, what programs they offer, what make them unique, different things. So I definitely recommend checking this out. In addition, we have a student ambassador program. So if you become a student at one of our member institutions, you could always be a part of this. But we use the ambassadors to share the student experience of what it's like to be a master's and doctoral student. So you might come across these ambassadors. We call them, this is public health ambassadors, and they are all over our social media. They are on our events, our virtual fairs. So you can actually talk to these students and learn what it's like and why they chose what they are studying and what they're hoping to do with their degree and what it's like to study at their institution. So they're a great resource for you. So the virtual fairs I just mentioned, we have two types, and we are in virtual fair season. So we have since 2014 offered virtual fairs 4 times a year, July, September, November, and January, through a platform called Career Eco. When you go to this virtual fair, you can see usually between 60 and 80 of our members participate at a time, and it's a chat room format. So you can go in, some might have a video going on, but you have the chance to type your questions to admissions staff or students, whoever they have staffing their room. This is also where you can ask our ambassadors questions. We have an Ask a Student room. So you can sign up for that. These are all free for you to attend. The next one's coming up in September. In addition, we used to, pre-COVID, have in-person graduate fairs. Last year, like everybody, we pivoted and now everything is virtual. So we have these additional virtual fairs where you can get to know smaller groups of our members at a time. So our full schedule is on thisispublichealth.org/events. I'll show you in a second. But for this particular type of event, what you're going to do is you're going to hear from 5 to 10 minute presentations from a number of our schools, usually between 4 and 8. And then you'll have a chance to go into a breakout room and ask questions for that institution. So these are really great opportunities for you to engage with the institutions that you're researching. So as I mentioned, if you go to thisispublichealth.org, you just want to hit the events tab, and then they should be updated now that this was a screen grab from a couple of weeks ago. So if you go there now, it's actually updated with all of our events, which they start next week. So I would definitely check it out and get registered for ones that look interesting to you. Additionally, if you click prospective students, it's going to take you to a page that looks like this. And you can also get to the events here. When you see the upcoming events, you can click through to get access to our digital view book. You'll see our social media feed. You can just stay engaged. If you put your name into the stay in touch, then you get our emails, which we don't email too frequently, but during the fall, we email more just to keep you up to date with all the events that are going on that you might want to participate in. We also have social media. We're very active on This Is Public Health. On Facebook, Instagram, and Twitter. And as I mentioned, our ambassadors take over our social media on a weekly basis. And so they're talking about all kinds of things, what they're passionate about in public health, what they're doing that week in school, if there's some cool event. So if you are not already following, I would definitely check it out and give a follow. It's always just fascinating to see what our students are up to. In particular, you want to check out I Heart Public Health Month, which we deemed February, I Heart Public Health Month back a few years ago. And so that's when we're telling stories about why people love and are passionate about public health. So that's a really cool time. And so if you scroll back in a few months on our social media, you'll find a bunch of these stories, or keep an eye out for this February, and we'll have new stories coming through. Also, we have a book club through Goodreads, and this book club is growing by leaps and bounds. I just checked the other day, we have over 1,000 members that are participating. Our ambassadors lead this book club, and so they pick a different book. Right now, they're picking books about every 2 months. So currently, they're reading The 10-Year War through September 30th, and so they're posting discussions and things like that about it there. The rest of the year, they're reading, starting October 1st, they're reading Hood Feminism, Notes from the Women That a Movement Forgot. December, they're reading Dreamland. February, they're reading The Spirit Catches and Then You Fall Down. And in April, they're talking about spillover, animal infections, and the next human pandemic. So this is a great way, if you're not sure about what public health is all about, join our book club and read some books along with us, and you'll get to know different topics. I know I'm still learning about all the different facets about public health, so it's just really interesting to read and learn about all the things that are going on. Up here are other books that we've read, and we have a great webinar with Jeff Oxendine, the author of You Don't Have to Be a Doctor. Our ambassadors read that, I don't know if it was this spring or last fall, but it's a great book if you're, again, trying to figure out exactly what your career path might be or in the health field. I highly recommend it. So you could read the book, you can follow along in the webinar that you can access through our website, and check out what he had to say. Okay, so you've done all of your research and now you're applying, but you're like, how am I going to pay for school? Very good question. We have a resource for that too. So one of our most popular pages on our website is Financing Your Degree. It's our scholarships database. So every summer we have an intern that helps us curate an active list of scholarships that are not just for public health students, but that public health students could be eligible for. So if you go to this website that's listed at the bottom, you'll see an accordion. If you scroll down, accordion that looks like this, and when you click all of the different tabs, you'll see, again, scholarships that we found online that you can apply for and help you. So scholarships through institutions are harder and harder to get each year. So when you have external funding like this, it only helps you to help fund your studies. Okay, sorry. The next up is the application. So now that you're ready to apply, what are you going to have to do? So as I mentioned, we use Sophus, and when you log into Sophus, you create an account, you're going to see these 4 quadrants: personal information, academic history, supporting information, and program materials. Give me 1 second. Okay, so when you'll put your basic biographical information and the personal information, you're going to fill out your transcript, history, and academics. Supporting information will be things like your references and your resume, and then your program materials are going to be unique to each one of your programs that you're applying to. So the first 3 quadrants are things that all the schools and programs that you apply to can see, and the program materials is unique. Okay, so let's dive into what those things are. Here are the general application requirements. For all of the schools and programs you apply to, you're going to need official transcripts for every post-secondary course you have taken that shows up on a transcript. It's got to be there. So you took 1 credit at a community college between summers, that needs to be on there. If you, whatever you took, you need to send it in, but it all goes to Sophus, and then all of your schools can see it. So it's nice, you only have to request it once. When you are putting in your official transcripts, you're going to enter every single course you had and your grade, and then SOFIS will get the official transcript and verify it. And so I just want to point out that students get frustrated with this bit, and I'm so sorry that you probably hear my son in the background, but students get frustrated with this bit, but it's actually really helpful for you, because what it allows SOFIS to do is calculate your GPA in a variety of different ways. So I know for me, I did better at the second half of my course undergraduate career than my first half. So they can actually show that in the GPA calculations. It can pull out just your math GPA. It can pull out different ways to look at your GPA. So it is really helpful to a student who maybe didn't have a perfect transcript otherwise. Okay, the next standard requirement is standardized test scores, but I put an asterisk here because with the pandemic, a lot of our members have pooled the requirement for the GRE. So this year, some of them did put that requirement back in, but by and large, a lot of them have removed the GRE permanently. So that's again why that program finder opportunity where you can search if that's important to you, you can say schools that are GRE optional or not required and just see those. So it's great. But if it does require it, you'll be able to put it into SOFIS and have your scores sent directly to SOFIS. You'll also need 2 to 3 letters of recommendation that will be dependent on what the school or program requires, but the minimum will be 2. Your letters of recommendation should be from supervisors or from professors. So that is definitely something to keep in mind. And you'll also upload a current resume. So the ones in orange are the ones that are standard across all. Now, you'll also have to write a statement of purpose. So this is one of those things that goes in that last quadrant that's going to be unique to every school or program that you apply to. And you want to make sure that it is unique. And you're talking about that particular institution. We'll go into that a little bit in a second. Also, every institution has additional requirements, and they vary from a couple of additional questions to a writing sample to an additional application that you might need to submit. So you're going to want to check that you know what all the additional requirements are for each institution that you're applying to. Okay, so when you're creating a stellar application, what you're trying to show to the admissions committees is that your ability to be successful in graduate school. So this can be shown in a variety of different ways. One, it can be your prior experience. And I don't just mean full-time experience here. If you have volunteer opportunities, or maybe you did a mission abroad, or anything that relates to public health that you can highlight, you're going to want to show that so you can show some experience and depth of understanding there. You're going to want strong recommendations. So as I was talking about, from either your faculty or your supervisors, you want people who can talk about your ability to be successful in grad school. So you want to make sure that the people that you're asking know you well and know what you're trying to accomplish and will be able to talk about that in your application. You are going to want to show that you have a clear purpose, that that you understand why you're applying to grad school and where you're trying to go, which again, we'll talk about in a moment. And then you're going to want strong academic indicators. So obviously you're going to an academic program. They want to understand that you could do well. So that could be your GPA. If you decide to submit GRE scores, that could be that as well. It can come from your letters of rec and faculty talking about how well you are a good critical thinker and a great writer and all these things that you need in grad school. And then other thing with that, I would say, if you do have any issues that are in you, that might be a red flag, right? If you didn't have a 3.0 GPA or you struggled one semester, maybe you were caring for a sick parent or something happened and you had to deal with that and your grades suffered. Don't shy away from talking about that in your application. You want them to understand that maybe if you didn't do your best, it wasn't because you weren't trying your best. It was because of other things that were going on, so that they understand that it's not a red flag. It's just it was a circumstance. So as much as you're comfortable talking about, it can usually help in your application. Okay, so I keep circling around your statement of purpose. So let's dive into that a little bit more. And what makes a good statement of purpose? So I like for people to tell their story. And when I say this, I should say, always be mindful of whatever prompts that the institution that you're applying to is giving you. That's the thing to answer first. But if they don't give you a prompt and you just have a general provide a statement of purpose, then this is where I would focus. 3 areas. Why are you interested in public health? What are your career goals? And why is this the program that's going to get you to where you want to be? So, giving a little bit of background. At what point did you become interested in public health? Was there something that impacted your life that put you down this path? When I talk about what your career goals should be or might be, I think that you need to have an exact, I want to be a XYZ role at an XYZ institution. But, if you know that you want to work on a specific population or a specific topic, that's kind of the general scope that you should be talking about. And then again, showing that you did your homework and that you understand that this is the type of work that's being done at the school. So it's unless you're applying for a PhD program where you need to have a faculty match, it's not critical, but you do want to show that you've done some research here. For example, if you're particularly interested in rural health and this is a school that focuses on urban health issues, maybe it's not a fit, or maybe you need to talk about why you think it is a fit. So that's the kind of thing that you can always talk about here. So just tell a good story and make sure it's clear and concise and compelling. Okay, just a couple more slides and then we're going to get to your questions. So let's talk about timeline. Right now, our SOFIS application just opened for this cycle. So we talk about cycles and we mean August to August. So August 21, we open for enrollment for 2022. So January or spring, summer, and fall entry 2022. If that's what you're aiming for, then you should be applying starting now. If you are thinking about spring, summer, or fall of 23, then you'll most likely be able to wait until the next cycle, which will open next August. So right now we've just opened, so you're going to see that deadlines are generally in the late fall and early winter. You're going to want to apply as early as you can, both to get everything in before the rush hits SOFIS and also to get usually to be considered for the limited scholarships that are available, you want to be an early applicant. So for master's programs, again, it's usually December 1st through February, end of February, is a bulk of the deadlines, but some accept much later and a couple might have them earlier, so always check, and that's on the academic program finder. So you're going to be applying, they're usually rolling offers, so you'll hear back, and then if you get funding or not, your deadline to respond is April 15th. If you are offered funding, that's the earliest date that a school or program can make you commit by. And so that's an important right to know that just about every one of our members has signed on to this April 15th agreement. So if you have funding, you have till April 15th. And then as it is rolling and there are people who have deadlines afterwards, if you apply in April for a program that's still open, then this will not apply to you, but these are the general timelines. So you've committed by April, and then the cycle does stay open till the beginning of August, so there will be some programs that are accepting all the way to August, but usually at this point you're transitioning because you're preparing to start that grad program. So so that is our cycle and our timeline, and this is the time to be doing your research and getting your applications ready if you're thinking about next fall. Okay, so I just threw a lot at you really quickly, but that is what I have. So we can spend the rest of the time answering questions.
Thank you so much, Tracy. I really appreciate your know-how and just experience. I think it's very valuable here. And even throughout the presentation, I was personally writing a couple of questions that came up on my end, and I'm going to go through those first right before we get to the audience Q&A.
Okay.
So, my first question is, as a former admissions officer, what are a few common mistakes that you've noticed on applications?
Okay, the biggest mistake, it always makes me cringe, is just putting the wrong school name in a statement of purpose. So, and I haven't seen anybody get denied from it, but a little bit of detail orientation goes a long way. For the school I worked at, when we say an application that said, I really am looking forward to attending school X, which was not my school, you're like, okay. Other than that, I'd say another pet peeve of mine was just when students would put their name in lowercase instead of using proper, capitalization. That was frustrating because that feeds into our system and then it's wrong everywhere. So these are just little baby things, but in terms of, mistakes that were detrimental to your application, not a lot. I would say, again, just making sure that you're telling your best story and you're mitigating any of those red flags, and then you're golden.
Thank you for your clarity on that. Outside of the GRE, and you specifically talked about changes because of the pandemic. Were there any other significant changes when applying to public health?
Sure. So there were questions that got added to our application last year, and I'm trying to remember, and I should know because I'm actually an applicant this year, so I'm going through it. But we put in some questions about how COVID impacted your studies. So you might see a question on that in this cycle. I'm not sure how long we're keeping that on there for, but it's a chance for you. Everybody dealt with a lot of change in a really rapid way last year. So, did your school go virtual? Yes. What was the impact? Were you having trouble in your home? You didn't have access to internet and had trouble getting classes. All of those things, you have a space to put that. And if the question isn't still on there, then you should write that in. There's other places that you could write that in, like your statement of purpose, or there's a other question you could, there's a place where you can put additional information to the admissions committee.
Perfect. And, just to keep with the theme of statement of purpose, when writing your statement of purpose, how would you navigate students, including information about COVID-19?
Okay, say that how would I?
Yeah, so as far as, when students are writing their statement of purpose, and this is more like I've heard this question a lot from pre-health advisors, they're typically struggling to, help students, include information about COVID-19, and I know this is like a different, health profession, and it's specific to public health, obviously, but I'd be curious to hear, is there a wrong way to present information about COVID-19 on your application? Maybe that might help the question.
Sure. So I think, I don't think there's necessarily a wrong way. Again, it's how did it impact your story? Was it that you were, again, struggling because you were taking classes and helping family and maybe got a sick parent or whatever it was that might have been impacting your experience? If that's relevant to your application, I would say put it in there. Again, it's whatever you're comfortable with and whatever feels like it's important for the admissions committee to know. I think it's fair game.
That sounds great. I'm now going to pivot over to the audience questions. And the first one that I want to touch on is, how does a master's compare to an MBA in terms of valuability in a field like public health, management, or admin?
Okay, so an MPH versus an MBA are are definitely different. And I think the bigger comparison there would be an MHA, a Master of Health Administration. That's where I see students usually debating between. So I would say an MHA is if you want to be a health administrator working in a hospital or insurance thing or businesses related to health, then that's going to give you a more focused experience versus an MBA, which is going to prepare you for any business setting. So it kind of depends on, again, where you want to go. If you want to have more flexibility, then maybe you don't want that specific focus. But if you're sure that that's your path, then I would definitely look at MHA programs. So an MPH is going to give you a different lens. And I wish I have an ambassador actually who has a great story about why he chose his MPH over an MHA, because he wants to really think about how healthcare administration is impacting communities. So that's the lens that he wanted to have his studies. So it kind of depends on what you want to do. If you wanted to reach out to students at ASPPH.org, anybody with any question can send that there. But if you send an email there, we could actually connect you to that ambassador and have them share their story if you want. But yeah, I just think it depends on what your career goals are and then what education you need to get there.
Thank you for the clarity on that. Do you still recommend taking the GRE, even though some schools aren't requiring it?
So check with the school and program that you're interested in, because some of them say, do not send them in. We don't want them. Some of them say, if you include it, we will review it, but we don't require it. So I would rather not study and take a test and pay a lot of money for something I don't need. So just look at all the programs that you're interested in before you make that investment. Because, and again, unless you do really well, and if they're going to even look at them, then that should help you make your decision.
Okay. Now I'm gonna pivot us over. It's a specific question on disabilities, and more so reporting. Could you speak to students who aren't sure? Could you speak, navigate students as far as those who aren't sure whether or not to disclose whether they have disabilities? Is there a right time? Is there like a wrong time? A little bit of clarity on that would be perfect.
That's a great question. Okay, I'm going to say from my opinion, and I would actually ask this question of the admissions offices that you're interested in too. I think if it's something that's impacted your application, like if you're going to mitigate, maybe you didn't do as well academically, but because you were diagnosed with something that impacted the way you were studying in the classroom, or if there's a reason that the disability would impact what they're seeing from the application, then I would disclose that. But if it's just something that you wouldn't necessarily be able to discern from the application, otherwise looks great, then I would say wait until you're admitted and then work with the student services office on any accommodations that you would need, because that's not going to impact their decision on whether or not to admit you. But if it impacted your grades or other thing that they might pick up on that they wouldn't know why we're different, then that could. Does that make sense?
No, that makes perfect sense.
Okay.
So I know we talked a little bit earlier during the presentation about joint programs. Could you speak a little bit more about that? Just give a little bit more clarity, I guess.
Sure. So if you go to the program finder and look at the degrees that you can search for, you will see /MPH for so many degrees, from things from like urban planning and vet med. There's so many options. And the reason is public health is so interdisciplinary, and that view that you're getting through public health in terms of systems and programs and evaluation and social determinants of health, health disparities, all of these things are really helpful for a lens for a lot of your different careers. So, maybe you want to be a lawyer and you want to really work on health policy and you're going to complement that with MPH. There's so many options. So again, it kind of depends on what your career goals are and what makes sense. A lot of our joint degrees, you're going to need to apply to both schools. So say the law school and the School of Public Health, and get admitted to both. And then you can be enrolled as the joint degree program.
What factors could help a student be a stronger applicant if they didn't have the strongest GPA or grades in undergrad?
Okay, so I would say get strong recommendations, explain why you maybe didn't do so well in your coursework, get some really solid experience. And then also you could take a class as a non-degree student, a graduate level course, and show that you have the ability to do that, to be successful in an academic setting. I think those are some of my top tips. And our members are looking at you as a whole package. They're looking at all the different pieces. So it's just think about, okay, if one piece is weak, where can I make something else strong to kind of balance that out, with the goal of, again, making you look like you're going to be able to be successful in grad school.
Okay. So for our next question, what kind of experience would you view as good to include when applying to public health programs? And I just like to throw out that SHPEP would be a great program to highlight on your application.
Absolutely, that would definitely be a great program to highlight. In fact, I believe we actually have a place on our application that you can check off that you participated in an SHPEP.
Typically, how long is a personal statement or the statement of purpose?
Sure. So some of it's dependent on the school or program. Some say cap at 2 pages, some say cap at 5 pages and double spaced. I don't believe we have a word limit at this point, but I would say be clear and concise, and you don't need a lot of fluff. You just need to make your point and tell your story, and do it in a way that's clear and concise.
Are there any specific majors you encourage during undergrad for students to pursue? And can anyone apply for a master's in public health?
That is one of the things I love about public health, is you don't have to have a particular background in anything. Again, because public health is so interdisciplinary, we need the perspective that so many different degrees bring to it. So I've had people who were journalism majors and they want to do reporting on health stories, or they want to create documentaries on health issues, and so that's why they're merging those things. We have art majors, we have English majors, we have business and architecture. It all connects to public health, and that's like one of the things I find most exciting about the field, is that you can impact people positively in so many different ways.
So earlier, when you were answering one of the questions, you mentioned having strong letters of recommendation. So who would you recommend if I'm a student, to write my letter? Should an academic advisor write the letter, or does it have to be a teacher or a supervisor, within the health professions field? What would you say?
Sure. So I think you can definitely get an advisor. Could make sense, as long as that advisor is somebody who knows you well. And I know from my undergrad experience, I had a different advisor every semester, so like that wouldn't have been the right fit for me. But so an advisor or faculty who can really talk about your ability to succeed in grad school, right? Like that's what I keep coming back to. But and I guess I would even consider a TA potentially, but I would try to get at least one faculty if at all possible. So hopefully you've done the work to build some relationships with faculty, and they, whether it's you've worked with them in a lab or you've met with them in office hours, or whatever a variety of ways that you could interact with the faculty. Hopefully they know you at least a little bit more than that you're one of 500 students in their class. So when you're thinking about who might be a best fit for you.
Okay. And as far as like timeline, do you recommend working in a public health field after undergrad, after you're earning your undergrad degree, or should you go straight into the MPH program right after your undergrad? Like, what do you propose?
It varies. We don't have many programs, though we do have a couple that require work experience. So there's a good portion of our students that come straight from undergrad. But I think there is a benefit to having a little bit of experience under your belt. It helps you kind of focus in on what you want to do. You're bringing something to a classroom discussion. You've already seen it applied. In the work setting, you can add to the discussion in a little bit different way. But again, there's a large chunk of our students that come straight from undergrad and are very successful. So it really depends on what your path is and what you are trying to accomplish. I know I sound like a broken record at this point, but there's no one perfect way to get to public health. And whichever way you go, you're going to be able to learn from and grow from that experience. And so you do you, and it'll be great.
Now, this is more of an application specific question. If the grades are viewable on your official transcript from your home institution, do you also need to provide transcripts from other institutions that you would have attended?
Okay, if it shows up on your home institution transcript,
Correct.
Yes. And so I'm with you. It is frustrating. That was a very personal example I gave earlier. I have one credit from a community college that I took and I transferred in, and it's really being hard for me to get, but it shows up on my transcript. So I have to make sure it's there. So the thing, when it shows up on your home transcript, it doesn't show your grade usually, because the credits transfer, but not the grade. So you have to show that original transcript. But again, for somebody like me, it's a benefit, because if I did really well in that class, it helps where it's not counted on my, the grade doesn't count towards your GPA. So it can help you.
So talking about GPA, what GPA is considered low, and what's like the average, I would say, for students who actually get admitted to public health programs?
Yeah, I don't have an average GPA off the top of my head across all of our members. I mean, it would vary by institution. If you're above a 3.0, I don't worry. If you're below a 3.0, then you're just going to have a little bit more explaining to do. And it's not impossible, but just a smidge harder.
Okay.
And I'm right there with you. So I didn't know what I wanted to do in my undergrad. I didn't do great, but I've already got a master's and I'm, in a much better place. So it can be done.
Good. Now,
and don't ever let your GPA keep you from applying. I just want to make that super clear. Like, there are no strict cutoffs. So don't let that be a barrier. And if you have any questions about that further, like, I'm happy to talk to you about that, but please don't let that be a barrier.
So, I know there's a lot of programs, and, you handle the SOFIS application. When should an applicant contact the programs directly? Like, in what situation would you say?
Sure. I'd say anytime you have a question, if you're applying for a master's program, it might be different than a doc program. A doc program, you should usually be in touch with the admissions office and potentially faculty. It's a little bit more of a, I don't want to say personalized, but you want to have your name on the radar, usually, generally speaking. At the master's level, we have plenty of students that go straight to the application and never contact admissions or faculty, and that's fine. But they're there to help you and make the process better for you. So don't hesitate to reach out. If something's not clear, or if you're trying to figure out something about their program or not sure if you're a good fit, just reach out. That's what they're there for. And if you don't want to do it directly, you can do it through any of our events, and I guarantee if you're asking the question, probably a lot of other people are asking it too. So when you go to something like one of our chat focused grad fairs, you might see that 5 other people have asked the same question. So you won't feel alone.
Perfect. Now, as an applicant, should we start our SOFIS profile before our statements and letters of recommendation are done?
I would, yes. So here's what I'm doing right now. The day it opened, I went in and I started my application. You can fill in the basic biographical information. I've started by submitting my names of recommenders, and then it emails them so that they can get in. And I've told all of my recommenders, we have 2 months. It's no big rush, but I want you to have access to it. Requesting transcripts, because you never know when there's going to be a hiccup like I've encountered. So the more you can do early, the better. And then, so I'm trying to get all of that stuff front loaded so that I can work on my statement of purpose. And then that's kind of where I'm going to shift gears here soon. I'm not saying this is the only way to do it, but that's my recommendation, because it just helps. So, if you can go in a little bit and knock out here and there, start adding your program, seeing what specific questions, or if there's any additional requirements your programs have, you can add the programs and see what they're requiring.
Okay. What concentration of an MPH would you say has the most diverse job opportunities?
Ooh. Oh, that's a great question that I don't know if there's an answer. There's so many opportunities. I don't know if I could answer that. I mean, because, you might be an epidemiologist and you could be studying anything from COVID to obesity epidemics to, foodborne illnesses, cancer epidemiology. There's so many things you could do there. Biostatistics, but I mean, even in like community and behavioral health, you could be working with so many different populations or specific diseases. There's a lot of diversity for career options, which is cool. I think. Oh, I lost your sound.
Sorry, can you hear me now?
Yes. So
where can a student get help with resumes? I know that you talked earlier about as far as, having to create a resume to apply to grad school. I guess, is there any resources, or is there anyone that you would say, personally, if I were to take a stab at that question, I would recommend speaking with your pre-health advisor personally. But if there's any other resources outside of that, I mean, feel free to add to that, Tracie.
What I would say, where I would go first, if you're currently in an undergraduate program, your undergraduate school definitely has a career services office somewhere in the university. So check them out first. If you graduated in the past, a lot of universities also have alumni career services offered. And so again, check with your university. It may be housed within the career services offices, or it might be housed in the alumni office. But they usually have services. So I always point to your university first. That's your best resource. If you don't have either of those, I would start Googling, and LinkedIn has a bunch of resources. There's tons online about, what a good resume looks like these days. You kind of have to pick and choose like what you find valuable. One other thing I've done is sometimes some of the career services offices, even if you didn't go to that institution, they have a lot of resources online. So if you're Googling, I would also look for other career services offices. Those are people who are kind of experts in what they do. So I would start there.
Thank you for that. So I have more of a question about grades. So let's say I took general chemistry, right? And I failed it the first time. And then the second time I got an A. So how are those repeat grades viewed? Are both of them calculated within the GPA, or is one disregarded? How does that all come together?
I forget the exact answer, but I know 100% that if you go to the SOFIS FAQ page, they have information about how repeated grades are calculated. If not on the SOFIS FAQ page, when you start your application, in the part about transcript, because I just saw it, it talks about repeated coursework. I didn't pay attention to it because I don't have repeated coursework, but I know it talks about it. So you can find the answer on SOFIS, either the public site or the application site.
Perfect. And, to close this out, do you have any final words for the applicants, for anyone that's on this call right now? Just give us like your parting words, any type of advice, being that you're going through this application process yourself.
Yeah.
What have you learned and throughout this process?
Yeah, well, I have to say it's definitely interesting having talked about the SOFIS application for the last 10 years and now being on the other side. I'm like, oh, that's why people struggle with this. So I get it. I can totally relate. I'd say, again, start early, give yourself time, even if you know your deadlines aren't till February, let's say. If you just go in now and just start poking around and knocking some things out and just getting acquainted with what you're going to need. And again, starting that transcript request process, especially if you've been to more than one institution, that's, it's a lot to do, and start talking to people that you want to recommend you, getting on their radar early, because you don't know if they have 100 students that have asked them to write recommendations. So you just want to make sure you're in the queue. But I think really it's a great time to do some self-evaluation and really think about what you want to do in this world and how you want to leave a mark. And I truly believe in the power of public health to improve communities and improve the health and lives of so many people. So, if that excites you at all, then you're moving in the right direction. So just really do some soul searching and be like, what do I want to do? And how do I want to make an impact? And let that be your guide. So you can't go wrong, and just showcase who you are, and it'll be great. And you will find your path. And we are always here to help you too. So in addition to all of our member institutions that have admissions people to answer questions, like I said, students at ASPPH.org, my team answers questions and helps put you in the right, point you in the right direction as well. So we're happy to help you too.
Well, thank you so much, Tracie. I feel like I learned so much during this session. Honestly, I genuinely appreciate it for me, and I know others on the call definitely appreciated it as well. As
Awesome.
always, for everyone, SHPEP webinars are posted within a week of the live viewing, and I recommend subscribing to our YouTube channel and hitting that notification bell to stay up to date with everything SHPEP and the health professions. Have a great evening, everyone.
Thank you. Thanks for having me.
Thank you, Tracie. Thanks again.
Bye.